Okay, it is coronavirus day 414 at the last day of the lockdown 2. So, and so we have today dangerously high cases. It is like slightly higher than yesterday. So yeah, at now standing at 3,887. Yeah, yesterday it was 3,871, a slight higher. So anyways, today the pace is Toronto is still in the dangerous, really, with 1,331 really high cases. In Toronto, Peel Region is at no lock with 871 high cases, 267 is from York Region, 208 is from Durham Region, and 204 is Hamilton. So all other regions are reported under 200 cases. 21 deaths are reported. Of course, I'm going to talk about variant cases. First, of course, UK variants have gone worse, with 65,960 variant cases, which is the absolute dangerous record of plus 3,016. A big giant increase from yesterday. 274 South African variant, which is the plus 31, and 645 Brazilian variant cases, which is the plus 144, and the India variant has not changed, at still at 36, and the Ontario government is doing a lousy job not doing anything about it, because the India double mutant variant is still like a new major threat, yet they labeled it as a variant of concern instead of labeling it as a variant of concern like the UK, South African, and Brazilian variants. They labeled it as variant of interest and say, oh, it's not that serious. But well, if you look at India, they are having like oh my god, it is like terrible over there, with at least 300,000 daily UK India mutant double mutant variant cases, and they had to cremate some patients who died of the India double mutant variant, and of course they didn't, and of course the government of Canada, they didn't do a proper block off any flights that might be from. So they only banned direct flights from. So the direct flights are banned from Pakistan and India. Yet, but these people from these countries, they could secretly take a connecting flight possibly they could making a making a connecting flight through the airports, like maybe in like Beijing, China, Incheon Airport in South Korea, Tokyo, Japan, or maybe they could like go through. I'm not too sure if the U.S. is any USA has done anything about blocking banning flights from there, but if they haven't, they could like maybe going through like a LAX in Los Angeles, or maybe Chicago O'Hare. In Chicago, and or JFK Airport in New York or something like that, and they could make a yeah, head into Canada that way. Literally making things worse. So well, I'm just going to talk about people talking about vaccine eligibility, and so apparently the Ontario Government Health Administration they expect everyone 18 and older to be eligible for coronavirus vaccines by the end of May. So of course they're pushing the numbers down. So it was like 80 plus and seniors and aboriginals, and then there's the focus on the 70 plus, 75 plus and the hot spots. And then it was bumped down to 60, and then 59 plus. And then they bumped it down to 40. And then now they're bumping it down to 18 up. So the province has said those are 30 plus are expected to eligible to schedule for immunization through an online booking system by the week of May 17th. So beginning April. So today, people age 55 and older will be eligible to book a coronavirus vaccine through Ontario. The book a vaccine online through, and the pilot project will that where they originally did Toronto, Kingston, Frontenac, Lennox and Addington region, and Windsor Essex region. But now they're doing it in hotspot communities in Toronto and Peel region. So these pharmacies will, however, they will administer the Pfizer BioNTech coronavirus vaccine to people aged 55 plus. So they will not be using the AstraZeneca vaccine, which people were very worried of, and even I myself. I'm trying to book a vaccine right now, but I don't want to get vaccinated by the AstraZeneca vaccine, which is the weakest out of the double shot vaccines, and the Pfizer BioNTech vaccine made by the Pfizer Incorporated and BioNTech company, and the Moderna Incorporated. But the issue with Moderna Incorporated right now is they always they're giving us short shippings of and AstraZeneca, we don't have enough. So apparently Justin Trudeau's asking Joe Biden to send over some AstraZeneca vaccine, so as if that's going to make it easier. It's kind of strange how that's going to work if they're doing America first, and And Justin Trudeau's asking. So each pharmacy is expecting to receive 150 Pfizer BioNTech vaccine doses per week. So the week of May 3rd to the 10th, that week, which is next week, the province will vaccine 50% of vaccine doses will be given to hotspots. And the weeks of May 17th and 24th, the province they'll give it to the rest of the province, not declared a hotspot. However, the hotspot allocation plan, it will not steal vaccines from other regions. So yeah. So next week, Ontario is scheduled to receive about 790,000 doses of the Pfizer BioNTech vaccine for 4 weeks. And after that, in the week of May 31st, we are expected to about 940,000 doses of Pfizer BioNTech vaccine for 5 weeks. This is probably because they upgraded their facility in Belgium and they're mass producing it. So, however, the Johnson & Johnson vaccine is it's coming in May. And it's next month. About 300,000 doses. And that's the single shot doses of the vaccine. So that's the easier one. It's actually effective against the variant cases too. So if you want to get vaccinated, so if you're like currently, it's currently for like if you were like a 40 plus pregnant, so actually special rules are down though. If you want to book online, so yeah. So you have to be apparently 55 years or older in 2021, 40 to 54 years old, frontline or healthcare worker, personal support workers, licensed childcare workers, special education workers, education working in education, elementary and secondary schools like teachers and staff, technically essential caregivers for residents and staff in shelters, community living, and other group living settings. Residents and staff in long-term care homes, or retirement homes. First Nations. People with highest risk health conditions and the caregivers. You have a chronic healthcare recipient, or if you're or have a special diagnosis like me. So, anyways, So anyways, this is depending on your age. You might have to wait next week, like or the next month, because yeah, because maybe you're too young, or like maybe like yeah, or your region isn't doing it yet, or so. Anyways, if you want to get vaccinated, you want to sign up for a vaccine, just so you can go on the like COVID slash dash 19 dot ontario.ca/book vaccine. And you are required to type in your postal code, and depending on your postal code, they might not let you in. Like I'm just doing it right now, and they didn't let me in because I'm not 40 years old, or like us. They didn't, despite my doctor's orders. So, so if there's like matters like this happens, you know, the other option is call them on the toll-free number 1-888-999-6488. I know I'm gonna sure do that. So stay-at-home rules, order rules are until May 5th. Pretty standardized, you know, next week. So it ends. The last day is Wednesday, May 5th. So once it becomes Thursday, May 6th, you do not have to follow. There's no rules, and we're gonna switch back to color zone rules. Depending on So it's pretty standard. You know. So remember, if you are like anyone who is trying to like break the stay-at-home rules or any rules, specific rules, they will be fined $750 plus $130 surcharge apparently, and event organizers will be charged $10,000. We've already had to deal with trouble in Peterborough, and then Coburg, again. Because, you know, people acting like this, it's only just making us like, instead of trying to escape out of coronavirus, instead we're going back, as I like to say it. It's the best way to express it, because instead of making it better for people, you're making it worse for people. Of course, I want to talk about hospitalizations. It's now at 2,201. It's sort of decreased by 47 minus. So that's a minus 47 there. However, okay, so we have so ICU patients are at 883 right now, -1. Making this the second highest record, and 632 ICU patients using a ventilator, which is plus 12. So this is like a sort of a. Oh wait a second. Oh wait, no. So that's apparently a new record. And speaking of ICU, after reading someone after the Vietnamese family having bring their dead uncle's body back from a hospital in Ottawa back to Toronto for a proper funeral. Yeah. So transferring patients from the ICU just because they didn't have room. Yeah. So it's not like the greatest idea, like best choice that people should be doing. Either take care of the patient, because if they don't if they have to literally like suffer from like trying to like bring back and their family they had to pay $1,062 to bring their dead uncle's body back. And of course, like they're going, this is a hotspot area. We're gonna move some patients to like the other hospitals. Well, they should have at least notified like the family, or maybe they should like make some agreements that maybe we should do this, maybe we shouldn't, instead of doing it and making them pay that much. So, hospital transfers to other regions and with lower cases isn't really a good choice. I would say. This is why we need to vaccinate a lot of people. Right away. And of course, they're being shady, and since they're also sending ICU patients to long-term care homes, they have not been telling us. It's about 8 days now since they haven't shown long-term care home deaths. Come on, this isn't a holiday. What's going on? So there's another thing to blame. I'm gonna blame the government for being like not revealing this, like not revealing long-term care home deaths or outbreaks. Cause they used to do this since they went, and after that they didn't really. And for the last for a few days, they haven't. Please follow coronavirus safety rules and regulations. Lockdown, and stay-at-home regulations, and don't have any gatherings. Follow Ontario Quebec border rules that crossing for essential reasons. I have the rules down below. Just remember, your rights aren't more important than the rest of us trying to lower cases and ICU patient numbers. And I mean, the people I'm talking about is people trying to not follow coronavirus regulations. Stay safe. If your doctor, and just saying, if your doctor recommends you get vaccinated, but apparently if your region, the region that you live in is not you're not eligible to get one yet, because I don't know. Just call them on the toll-free number, and yeah, don't be your best option.